June 8, 1944. A field hospital 3 miles inland from Omaha Beach, Normandy. Dr. Friedrich Hoffmann, a captured German medical officer, watched with professional detachment as American medics carried wounded soldiers into the surgical tent. His detachment lasted approximately 3 minutes. That's when he saw something that contradicted everything he understood about battlefield medicine. An American private lay on a stretcher, unconscious, his leg grotesquely swollen. The smell was unmistakable: gangrene. Gas gangrene, specifically. The tissue was necrotizing, turning black, releasing the distinctive, sweet, rotten odor that every combat surgeon knew meant one thing: amputation. Maybe not even that, maybe just death. In the Wehrmacht, Dr. Hoffmann would have already prepared the amputation instruments. If the patient was lucky and the surgery successful, he might survive. Most didn't. Gas gangrene was a death sentence that occasionally, mercifully, could be delayed through radical surgery. But the American medic wasn't preparing for amputation. He was preparing an injection, a syringe filled with yellow liquid. Dr. Hoffmann leaned closer, forgetting for a moment that he was a prisoner. The medic noticed his interest and, with the casual friendliness that Hoffmann found baffling in Americans, explained in broken German, "Penicillin, wonder drug. He'll be walking in 4 days." Hoffmann laughed, not from cruelty, but from disbelief. No drug could reverse gas gangrene. The infection was too aggressive, too deadly. The American medic was either lying or delusional. 4 days later, the American private was indeed walking. The swelling had subsided. The necrotic tissue had stopped spreading. The infection was gone. Dr. Hoffmann demanded to examine the patient, certain there must be some explanation. There was no medical precedent for what he was witnessing. The American surgeon, Captain James Morrison, showed him the penicillin vials with something approaching pride. "We've got thousands of doses," he said, "produced in American factories, mass-produced like automobiles. We're saving soldiers who would have died in every previous war in history." Dr. Hoffmann held one of the vials, studying the yellow liquid that seemed to contain impossible properties. "This is from mold?" he asked, incredulous. "Bread mold, essentially," Captain Morrison confirmed. "Discovered by accident, perfected through chemistry, manufactured through American industrial capacity. It's changing everything." That night, in the prisoner holding area, Dr. Hoffmann sat awake, unable to process what he'd witnessed. The Americans possessed a medical miracle that Germany not only didn't have, but hadn't even heard of. A drug that could reverse infections that had killed soldiers since the first human picked up a weapon. And they were producing it in such quantities that they gave it to enemy prisoners. This is the story of penicillin in World War II. Not just a medical discovery, but an industrial achievement that represented everything about American power that Germany had failed to understand. It's the story of how a laboratory curiosity became a mass-produced miracle. How American factories transformed mold into medicine faster than anyone thought possible. And how German doctors, trained in the finest medical tradition, confronted American innovation that made their expertise seem medieval. Penicillin didn't win the war, but it saved more lives than any weapon took. And in doing so, it revealed a truth about industrial democracy that authoritarian systems never grasped. Abundance in peace creates capacity for miracles in war. The story begins not with war, but with accident. Not with planning, but with observation. Not with German precision engineering, but with British scientific curiosity and American industrial excess. September 1928, St. Mary's Hospital, London. Alexander Fleming, a Scottish bacteriologist, returned from vacation to find his laboratory in mild disarray. Petri dishes containing Staphylococcus bacteria cultures had been left uncovered. Most were contaminated with various molds and bacteria from the London air. Fleming prepared to dispose of the contaminated dishes. Then he noticed something odd. In one dish, a blue-green mold had grown. Nothing unusual about that. Mold contamination was common. But around the mold, in a clear circle, no bacteria grew. Something in the mold was killing the bacteria. Most scientists would have discarded the contaminated dish and moved on. Fleming's genius recognized that contamination might be revelation. He cultured the mold, identified it as Penicillium notatum, and discovered that it produced a substance that killed a wide range of bacteria. He called this substance penicillin. He published his findings in 1929. The scientific community barely noticed. Fleming understood penicillin's potential, but couldn't isolate it in useful quantities. The mold produced penicillin in such tiny amounts that extracting and purifying it seemed impractical. He moved on to other research. Penicillin remained a laboratory curiosity for over a decade. In 1939, as Europe descended into war again, two scientists at Oxford University began researching antibacterial substances. Howard Florey, an Australian pathologist, and Ernst Boris Chain, a German-Jewish biochemist who had fled Nazi Germany, were searching for alternatives to sulfa drugs, which had limited effectiveness. They rediscovered Fleming's forgotten penicillin research. Unlike Fleming, they had newer techniques for extraction and purification. By 1940, they had produced enough penicillin to test on mice. The results were extraordinary. Mice injected with deadly bacteria and then treated with penicillin survived. Control mice without penicillin died. On February 12, 1941, they conducted the first human trial. Albert Alexander, a 43-year-old policeman, was dying from a bacterial infection that had started from a scratch while gardening. The infection had spread throughout his body. He had abscesses on his face, scalp, and arms. His eye had been surgically removed. He was delirious with fever and pain. Florey and Chain administered their entire supply of purified penicillin, about 160 milligrams. The results were dramatic. Within 24 hours, Alexander's fever dropped. The abscesses began healing. He regained consciousness and recognized family members. But the supply of penicillin ran out after 5 days. The infection returned. Albert Alexander died on March 15, 1941. The experiment was simultaneously a spectacular success and a tragic failure. Penicillin worked. There just wasn't enough of it. Florey and Chain calculated that producing penicillin in clinically useful quantities would require industrial facilities far beyond Oxford's laboratory capabilities. Britain, under German bombardment and fighting for survival, couldn't spare resources for speculative pharmaceutical production. In June 1941, Florey flew to the United States. He carried samples of Penicillium mold smeared into the lining of his coat, a precaution in case his luggage was lost or the aircraft was shot down. He was coming to ask America to solve a problem British science had identified but British industry couldn't address: how to mass-produce a miracle. American pharmaceutical companies and government laboratories examined Florey's research with interest, but most were skeptical about large-scale production. Penicillin was difficult to extract. The yields were tiny. The purification process was complex. Commercial production seemed impractical.
Then the U.S. Army got involved. Military medical officers understood what penicillin represented. Bacterial infections killed more soldiers than bullets in previous wars. Wound infections, pneumonia, sepsis, these were the invisible enemies that turned survivable injuries into death sentences. A drug that could stop bacterial infections would revolutionize battlefield medicine. The U.S. government launched a research program to solve penicillin's production problems. The Department of Agriculture's Northern Regional Research Laboratory in Peoria, Illinois, took the lead. Their assignment? Find ways to produce penicillin in quantities measured in pounds, not milligrams. The Peoria laboratory approached the problem from multiple angles. First, they needed better mold strains. Fleming's original Penicillium notatum produced penicillin in tiny amounts. They launched a global search for more productive strains. The breakthrough came from an unlikely source. Mary Hunt, a laboratory assistant nicknamed Moldy Mary, was tasked with collecting local mold samples. She brought in a moldy cantaloupe from a Peoria market. The mold growing on that cantaloupe, Penicillium chrysogenum, produced 6 times more penicillin than Fleming's original mold. Scientists then mutated this strain using X-rays and ultraviolet light, creating variants with even higher production. By 1943, they had strains producing 1,000 times more penicillin than Fleming's original mold. The first production problem was solved through patient experimentation and luck. The second problem was cultivation. Penicillin needed to grow in liquid medium, and the laboratories had been using small flasks. Industrial production would require something dramatically different. The solution came from an unexpected direction: the American brewing industry. The same fermentation tanks used to brew beer could be adapted to grow penicillin mold. Pharmaceutical companies like Pfizer, which had experience with fermentation processes, proved ideal for penicillin production. By late 1942, several American pharmaceutical companies were producing penicillin in experimental quantities. The yields were promising, but still inadequate for military needs. The Allied invasion of North Africa would require thousands of doses. D-Day would require millions. The U.S. government invested heavily in production facilities. Pfizer built the first plant dedicated to deep tank fermentation of penicillin. Other companies followed. The War Production Board allocated resources, steel, labor, and materials with the same priority given to aircraft and ammunition production. The Manhattan Project gets historical attention as America's great wartime scientific achievement, but penicillin production was equally impressive. Both required solving unprecedented technical problems under wartime pressure. Both succeeded through combination of scientific innovation and industrial scale. By 1943, American factories were producing enough penicillin for military trials. The results were spectacular. Soldiers with bacterial pneumonia, which had killed millions in World War I, now recovered in days. Wound infections that would have required amputation healed with antibiotic treatment. Sepsis, which killed more injured soldiers than the original wounds, became survivable. The military medical establishment realized they weren't just treating individual patients more effectively. They were fundamentally changing battlefield mathematics. Soldiers who would have died could now return to duty. Field hospitals could handle more patients because recovery times shortened dramatically. The entire logistics of battlefield medicine transformed. For D-Day, planned for June 1944, military planners requested massive quantities of penicillin. The pharmaceutical industry responded with production that would have seemed impossible just 2 years earlier. By June 6, 1944, American factories had produced 2.3 million doses of penicillin, enough to treat every wounded soldier in the initial invasion waves, enough to stock field hospitals across England and France, enough to change the casualty statistics of the most ambitious military operation in history. German military medicine had nothing comparable. German pharmaceutical companies had never prioritized antibiotic research. When war began in 1939, German military doctrine emphasized preventative medicine, keeping soldiers healthy rather than treating infections after they occurred. This approach worked reasonably well in the early war years when German forces were winning quickly. But as the war dragged on and German soldiers fought in Russia, North Africa, and Italy, bacterial infections became a massive problem. Frostbite in Russia led to infections. Desert wounds in North Africa became infected. Italian mud harbored bacteria that caused horrific infections. German doctors treated infections the same way doctors had for centuries: surgical debridement, cutting away infected tissue, amputation when necessary, and hope. Sulfa drugs helped somewhat, but were limited in effectiveness. Mortality rates from infected wounds remained devastatingly high. German military intelligence knew the British were researching antibacterial substances. Intelligence reports mentioned penicillin as early as 1942, but German analysts dismissed it as experimental research unlikely to produce battlefield-useful quantities anytime soon. They assumed penicillin, like many promising laboratory discoveries, would remain impractical for mass production. This assumption was catastrophically wrong. But Germany had no way to verify it until captured soldiers and medical personnel began recording direct experiences with American penicillin in 1943 and 1944. The first reliable German reports came from North Africa. After American forces landed in Operation Torch in November 1942, German soldiers captured during the Tunisia campaign encountered American battlefield medicine. Some were wounded during capture. They expected minimal treatment, enough to prevent death but nothing more. Instead, they received the same medical care as American soldiers. German prisoners with infected wounds received penicillin injections. The results shocked German medical officers among the prisoners. Infections that would have killed soldiers in Wehrmacht care healed rapidly under American treatment. Soldiers expected to die survived. Soldiers expected to lose limbs kept them. Hauptmann Dr. Werner Schultz, a German military surgeon captured in Tunisia, wrote in a letter after the war,
"We knew the Americans had abundant supplies, this was no surprise, but seeing them use a drug that reversed infections we considered fatal was paradigm shifting. I watched American medics treat our wounded with the same drug they used for their own soldiers. The psychological impact was profound. These were not the barbaric enemies our propaganda described." These reports filtered back to Germany through Red Cross channels and repatriated medical personnel. German military leadership requested information about penicillin production capacity. Intelligence analysts concluded that America must have small-scale production but couldn't possibly manufacture penicillin in large quantities. The fermentation process was too complex, the purification too difficult. Mass production was implausible. They were wrong. By mid-1943, American pharmaceutical companies were producing penicillin in tons, not pounds. The production capacity would only increase. The D-Day invasion on June 6, 1944, represented the largest deployment of penicillin in history. Every American unit landing on the beaches carried supplies. Field hospitals were stocked with thousands of doses. Mobile surgical units had refrigerated supplies. The logistics of distributing penicillin across the invasion force were as complex as distributing ammunition, and as essential. German defenders captured during the Normandy fighting provided the first large-scale testimony about penicillin's effectiveness. Dr. Friedrich Hoffmann, whose experience opened this story, was typical of German medical officers who encountered American battlefield medicine in 1944. In a post-war interview, Dr. Hoffmann elaborated on his initial shock. "I had trained at Heidelberg. I considered myself knowledgeable about current medical science. Yet the Americans possessed a pharmaceutical that seemed miraculous. Gas gangrene, which we considered a death sentence requiring immediate amputation, they treated with injections. Sepsis, which killed perhaps half our seriously wounded, they reversed with a drug grown from mold. The technological gap wasn't just production quantity, it was a fundamentally different approach to bacterial infection." German medical officers captured in France were interrogated about Wehrmacht medical capabilities. Allied intelligence wanted to know if Germany had similar antibiotics in development. The answer was no. Germany had focused on synthetic drugs and traditional treatments. The concept of mass-producing a naturally occurring antibacterial substance hadn't been pursued with anything approaching American resources. This revealed something more significant than medical capacity. It revealed philosophical differences in how America and Germany approached complex problems. Germany emphasized precision, expertise, and controlled development. America emphasized scale, speed, and brute force industrial solutions. Penicillin exemplified the American approach. Find something that works, even imperfectly, then manufacture it in overwhelming quantities. As Allied forces advanced through France and into Germany in late 1944 and 1945, penicillin's impact became undeniable. American, British, and Canadian forces suffered significantly lower mortality rates from infected wounds compared to German forces. This wasn't solely due to penicillin, but it was a major factor. Statistical analysis after the war showed that in World War I, approximately 18% of soldiers with serious wounds died from infection. In World War II, for American forces with access to penicillin, that rate dropped to less than 1%. The difference represented tens of thousands of lives saved. German military medical services tried desperately to obtain penicillin. Some was captured from Allied medical supplies, but quantities were insignificant. German pharmaceutical companies attempted to produce penicillin in late 1944, but the industrial infrastructure and expertise weren't available. Small laboratory quantities were produced but never reached clinically useful scale. By early 1945, German doctors treating wounded soldiers knew their patients faced worse odds than Allied wounded solely due to lack of antibiotics. This knowledge affected morale among medical personnel who took pride in their professional capabilities, but lacked the tools to save lives they might have saved. The treatment of prisoners of war further highlighted the disparity. Under Geneva Convention obligations, America provided medical care to access prisoners equivalent to care for American soldiers. This meant that German and Italian prisoners with infected wounds received penicillin. The result was that German soldiers held as prisoners in America often received better medical care than German soldiers in German hospitals. This fact, communicated home through prisoner correspondence, had profound psychological impact. The enemy nation was saving German lives that Germany itself couldn't save. Post-war interviews with German POWs revealed consistent themes. They were shocked by American material abundance, as discussed in previous videos, but medical care affected them differently, more personally, more emotionally. When you're sick or wounded, abstract concepts about industrial capacity become visceral experiences about whether you live or die. One German POW, interviewed in 1946, expressed this clearly. In prison camp in Pennsylvania, I developed pneumonia. I expected to die. I had seen pneumonia kill men in Russia. The American doctor gave me injections for 3 days. The fever broke. I recovered completely. Later, I learned my brother had died from pneumonia in a Wehrmacht hospital in 1944. The Americans saved an enemy, while my own country couldn't save its citizens. This contradiction haunted me. The penicillin story doesn't end with military medicine. The same production capacity that supplied battlefield hospitals became the foundation for post-war pharmaceutical industry transformation. American companies that had learned to mass-produce penicillin continued production for civilian use after the war.
By 1946, penicillin was available to American civilians. The price dropped rapidly as production scaled. The wonder drug that had been priceless in 1943 cost less than $1 per dose by 1950. Diseases that had killed millions throughout history became treatable with a week's supply of pills. The global impact was transformative. American pharmaceutical companies exported penicillin worldwide. European countries, including Germany, rebuilt their pharmaceutical industries with American technical assistance. The knowledge that bacterial infections could be treated with antibiotics changed medical practice permanently. Fleming, Florey, and Chain shared the Nobel Prize in Medicine in 1945 for penicillin's discovery and development, but the production miracle was American achievement. British scientists discovered it. American industry made it real. This distinction matters for understanding America's role in World War II. Germany had excellent scientists and engineers. Japan had sophisticated technical capabilities, but neither had American industrial culture.
the willingness to take laboratory curiosities and scale them to mass production with stunning speed. Penicillin required solving problems German precision engineering wasn't equipped to handle. The process was messy, biological, inconsistent. Early batches varied in quality. Contamination was constant. American engineers embraced the messiness, developed quality control processes that accommodated biological variation, and produced anyway. They prioritized functional abundance over perfect precision. This approach, good enough, produced in vast quantities, refined through iteration, characterized American industrial warfare. German tanks were technically superior to American Shermans. German fighters were faster than American bombers, but America produced tanks and bombers in quantities that overwhelmed technical superiority. Penicillin followed the same pattern. Not perfect, but abundant. And abundance won. The medical legacy of wartime penicillin production extended far beyond antibiotics. The fermentation technology developed for penicillin became the foundation for producing other pharmaceuticals. The quality control systems, the purification techniques, the industrial-scale biological manufacturing, all of this infrastructure, built under wartime pressure, became peacetime pharmaceutical industry standard practice. Modern biotechnology owes enormous debt to penicillin production techniques developed between 1941 and 1945. The ability to grow biological organisms in controlled industrial settings, extract their products, and purify them to pharmaceutical grade, this foundational technology was perfected while producing penicillin for battlefield hospitals. German pharmaceutical industry, destroyed by war and divided by occupation, rebuilt slowly. By the 1950s, German companies were producing antibiotics and other modern pharmaceuticals. But the decade-long gap in antibiotic development meant Germany lost its pre-war position as a leading pharmaceutical manufacturer. American companies, Pfizer, Merck, Lilly, became global leaders, a position maintained into the 21st century. This shift in pharmaceutical leadership was a direct consequence of wartime penicillin production. American companies learned techniques and gained experience that German companies, cut off from research and development during war years, never acquired. When global pharmaceutical industry expanded after 1945, American companies had insurmountable advantage. For individual German doctors like Dr. Hoffmann, who witnessed penicillin's effects firsthand, the experience was both professionally humbling and personally transformative. Post-war medical education in Germany had to incorporate American developments that had occurred during war years. German doctors who had considered themselves among the world's best-trained medical professionals had to acknowledge that American battlefield medicine had surpassed German capabilities. Dr. Hoffmann, in his final interview before his death in 1982, reflected on his encounter with penicillin in Normandy. I had been taught that German medical science was world-leading. We had pioneered bacteriology, developed surgical techniques, established clinical standards. Yet the Americans deployed a drug we didn't have, couldn't produce, and hadn't even seriously attempted. This wasn't about individual brilliance. Fleming was British after all. This was about industrial capacity applied to medical problems. America could take a laboratory curiosity and manufacture it in tons within 2 years. Germany couldn't. This revealed something fundamental about national capabilities that our propaganda had denied. This reflection captured something essential about America's World War II achievement. It wasn't about superior soldiers. German troops were often better trained. It wasn't about superior equipment. German weapons frequently had technical advantages. But it was about superior capacity to identify problems and solve them through industrial scale and speed. Penicillin exemplified this perfectly. The problem: bacterial infections kill soldiers. The solution: mass-produce antibiotics. The execution: mobilize pharmaceutical industry, fund research, build production facilities, and deliver millions of doses within 3 years. From laboratory curiosity to battlefield standard in the time it took to plan and execute the Normandy invasion. German military medicine never recovered the parity. By 1945, the disparity in medical care between Allied and German forces was severe. Allied soldiers knew they had access to miracle drugs. German soldiers knew they didn't. This knowledge affected morale, willingness to fight, and decisions about surrender. Soldiers who believe their nation can't care for them if they're wounded fight differently than soldiers confident in their medical system. American, British, and Canadian forces in 1944 and 1945 knew penicillin would save them if bacteria didn't. German soldiers knew infection meant probable death. The psychological burden of this knowledge is difficult to quantify, but certainly affected combat performance. The human cost of Germany's penicillin absence is impossible to calculate precisely. How many German soldiers died from infections that penicillin would have cured? Tens of thousands, certainly, possibly hundreds of thousands. The exact number is unknowable, but every German military hospital recorded infection deaths that Allied hospitals had learned to prevent. German civilians suffered similarly. Post-war Germany, under occupation and reconstruction, lacked access to antibiotics until American and British authorities provided supplies. German children died from infections that American children survived routinely. This disparity lasted years, creating generational memory of American medical superiority that influenced post-war German-American relations. The Marshall Plan, which rebuilt Western Europe after 1947, included pharmaceutical aid. American penicillin production supplied European hospitals, while European pharmaceutical industry rebuilt. This medical assistance was less publicized than economic aid, but equally important for population health and post-war recovery. Today, antibiotics are so common that we forget their revolutionary impact. Bacterial infections that killed our great-grandparents are treated with pills we barely consider miraculous. Penicillin and its descendants have saved more lives than any medical advance in human history. The death rate from bacterial infections dropped over 95% in the century since Fleming's accidental discovery. But the World War II chapter of this story revealed something beyond medical history. It reveals how industrial capacity, America's unique strength, could be applied to problems that seemed biological or chemical rather than mechanical. Germany made the finest precision instruments and engineered the most sophisticated weapons. America grew mold in beer tanks and saved millions of lives. This wasn't accident, this was philosophy. American industrial culture embraced messy, imperfect solutions that could be mass-produced. German industrial culture emphasized precise, perfect solutions that couldn't be scaled. In pharmaceuticals as in warfare, mass production defeated precision engineering. The German doctors who witnessed penicillin's effects never forgot the experience. Their testimony, preserved in post-war interviews, consistently emphasized not just medical details, but psychological impact. They had believed German science and medicine were world-leading. The American achievement in mass-producing penicillin shattered that belief comprehensively. Penicillin production represented a kind of warfare that Germany never understood. Industrial warfare where victory goes to whoever can scale solutions fastest. Not the best solution, the solution that can be produced in overwhelming quantities quickly. Penicillin was discovered by Fleming. It was made work in laboratories by Florian Chain. But American pharmaceutical industry made it real, made it abundant, made it available to millions. That transformation from laboratory curiosity to battlefield standard to post-war civilian medicine available to all, that was American achievement. And it saved more lives than all the weapons of World War II destroyed. The German doctors couldn't believe it. American medics were saving enemy soldiers with a mold they called a wonder drug. But belief didn't matter. The evidence was undeniable. Soldiers who should have died lived. Infections that had been death sentences became treatable conditions, and America was producing this miracle drug in quantities that defied comprehension. Penicillin didn't just change medicine, it changed how the world understood American power, not powered to destroy, but powered to create. not precision engineering, but mass-produced abundance. Not superiority through excellence, but superiority through scale. The mold that saved millions began with accident, survived through observation, and succeeded through American industrial capacity applied without limits. From Fleming's contaminated Petri dish to 2.3 million doses on D-Day in 5 years, that's not just medical progress, that's a revolution in how humanity solves problems. And the German doctors who witnessed it understood. They weren't just seeing a better drug, they were seeing a different civilization's approach to challenges. A civilization that could take a moldy cantaloupe from a Peoria market and transform it into the weapon that saved more lives than any other in history. If stories like this fascinate you, the medical breakthroughs, the industrial miracles, the moments when science and manufacturing changed history, then you're in the right place. Hit that subscribe button and turn on notifications so you never miss an episode of War Rewind. We're uncovering the untold stories of World War II every week. Not just the battles, but the innovations that changed medicine, technology, and daily life forever.